Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. We're also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. A welcome to the media in attendance this afternoon, and as always, we invite you to submit your questions here on Microsoft Teams. If you can just click on the question icon, and when you do submit your question, if you could indicate your name as well as your media outlet and who your question is for. And finally, to those joining us on Rogers Television this afternoon, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, 980 CFPL, and those who are watching on the CTV London website, we welcome you as well. Let's get to our opening remarks, and we will start today with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. I'm very encouraged to see the progress not only being maintained in our fight against COVID and seeing progress continue to accelerate across multiple fronts. You know that today marks the 5th straight day where case counts have been less than 50 in London, Middlesex. We've seen similar positive signs at the provincial level where we've had 4 straight days with case counts under 1,500, in fact, a bit over 1,000. Locally and provincially, we're also continuing to see strong uptakes on vaccines. And while Dr. Mackie and I continue to work with the province to address the overall deficit, our existing supply is more than adequate today, and we have thousands of appointments available for anyone 12 and up. So for all the positivity and cause for optimism, there's also another sobering reminder today about the need to get your shot as soon as possible so that we can continue to show adherence to the public health protocols. As you've seen from today's dashboard update, another individual from London Middlesex has died of COVID-19. And this was not someone my age or Dr. Mackie's age or Dan Flaherty's age. This was a 24 years old. So on behalf of all Londoners, I offer my deepest condolences to his family and friends, because this is an absolute tragedy. These types of worst case scenarios are happening with less frequency than we have seen during the first and second waves, though it's a sobering reminder that even young people remain vulnerable to COVID-19, especially with these more transmissible variants. You'll remember it was but a few short weeks ago where an 18-year-old young man from our community died after contracting the virus. It happens, and it can continue to happen so long as we have people who are not vaccinated. And that's why it was so important at our last media conference to have London Knight Luke Evangelista. He was tremendous, because he represents another segment of the population, and maybe as an important representative, delivers a key message. He's someone who got both his shots already, but he was delivering a very strong and committed message about getting your shot. So please, my appeal, Luke's appeal, Dr. Mackie's appeal, all of us, our appeal is that for every Londoner who is over the age of 12, if you haven't got your shot, book your appointment today, because it not only protects you, it protects everyone you come in contact with, and it will help us safely reopen our economy sooner and ultimately help us defeat COVID-19. We pray that everyone is listening to these words and gets the shot. Thanks. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor, and for your thoughtful reflections. You know, it really was a shock this week to see another death in such a young person so soon after the first. You know, we had this gentleman pass who was just 18, was otherwise perfectly healthy, and now to see another case in a 24-year-old man really just brings home the importance of getting young people vaccinated. Folks, if you are a young person or you know somebody who is, please make sure that we can get as many young arms down to the clinics as possible. We do have space to book right now. We need absolutely everyone who is eligible to come down, get vaccinated. We had 49 cases yesterday. Overall, that continues our downward trend from a 7-day moving average perspective. We're very much approaching the times when it will start to become safe to reopen things soon. We are not there yet. We are not at a time yet when we can see significant reopenings across the community without risking another fourth wave. You don't have to look far just across the border into Manitoba to see that vaccination rates as high as those in Ontario do not completely protect a society. Manitoba has a rate of COVID right now that is as high as they've ever been, higher than the rate in Ontario ever reached per capita. And that's in spite of very high vaccination rates. So we need to get the vaccine rates high, not just high, but even higher than anywhere else in Canada. And we also need to keep our public health measures in place at this time. It will become easier over the summer. We know that summer makes a difference in fighting this sort of virus. We know that as we get vaccination rates, up in the 70, 80%, that really will help. But we will need some public health measures in place for some time. The rate we expect within the next few days, we expect to hit something around 60% of adults in Middlesex and London. We were, as we reported on Monday, about 53.5% as of last week's data. And we're booking something in the range of 5% of our population each week. So that is obviously continuing to move in the right direction, still vaccinating over 33,000 people per day. And, while we do at the present time see flat allocation rates, I suspect that may change. We're definitely seeing communities, hotspot communities, that have been, 1 or 2 weeks ahead of us start to run out of first arms to vaccinate. And so once that happens, we hope that there will be more supply around here so that we can catch up. Dan, I'm going to pause there. Happy to take any questions.
Thank you very much, Dr. Mackie, and thank you, Mayor Holder. We do have a lot of questions already in the queue, so let's get to those right away. Dr. Mackie, the first question this afternoon is for you, and it comes from Jane Sims at the London Free Press. Dr. Mackie, the news out of Toronto is that the government is moving up second doses of vaccine for folks over age 80 starting next week. How quickly can the health unit reschedule that group? How are people being contacted? How soon will they get their second shots? And is this a signal that other age bands can expect a shorter time interval between their shots?
Appreciate the question, Jane. We will not be able to move to rebooking folks over 80 in the next few days. We are behind Toronto in terms of vaccination campaign for first doses. And, there's nobody that would argue that we should discontinue offering first doses in order to rebook. There are some spots in the system available right now, but we absolutely need to keep those open for young folks that haven't been booked yet. Remembering that the news that 12 to 17 could become vaccinated came late on a Friday, we really don't have confidence that that message has reached the parents and adolescents in that group in order for them to really fully take advantage of the existing appointments available. Our clinics are booked up for the next couple of weeks. If we do get additional allocations, we will open up more spots. But all that to say, at this point, first doses is where we need to continue to be. A letter will come out either today or tomorrow in partnership with the 2 health units, Middlesex-London and Southwest Public Health, to parents of students in the region to make sure that they all have the accurate information. We'll give those folks a few days, see what the uptake is there, and make a determination as soon as we can when we can reopen to folks rebooking their second doses in the 80+ crowd.
Thank you, Dr. Mackie. Let's go to a follow-up question from Jane Sims. Dr. Mackie, Western University, in consultation with the health unit, announced all students and residents will need at least 1 vaccination. Given the current 16-week time lag between first and second shots, is the health unit planning to set up mobile clinics at both Western and Fanshawe in September so that A, unvaccinated students can get first doses, and B, partially vaccinated students can get their second doses?
Yeah, we certainly hope to, Jane. It'd be wonderful to have vaccine capacity on site at those locations when students are coming back to school. that's something that is on our horizon, and we're very much in the process of building out additional mobile capacity. As you know, we've had a mobile team in the field since January, really. When we were able to start moving vaccine out into the long-term care facilities, there are just too many mobile locations to be able to offer in all locations right now. Obviously, those Fanshawe Western, these are very important and large communities where we know the risk of spread can be high, and we'll definitely be working with them on a campaign that's going to work for that population.
Thank you very much. Let's go to our next question. McKinley Leonard Scott is joining us from the Middlesex Banner this afternoon. Dr. Mackie, and this actually speaks a bit more to the interval between doses, if our vaccination rates were to hypothetically increase in the coming weeks or months, actually we're seeing more people getting vaccinated all the time, could second dose appointments be moved forward?
Yeah, this is the real art of balancing needs right now, because as from day one of the vaccine campaign, there are more places and people to give vaccines to than there are vaccines. And so, it's still an issue of prioritization. First doses still are the priority right now. We could see second dose appointments move forward, but it's a bit premature right as it is. I think maybe the question is if we saw much larger uptake in people that haven't been vaccinated yet, could we move second doses up? And I think the point is well taken. If we continue to see strong uptake, it will be difficult to move second doses any further forward.
The next question, Dr. Mackie, comes from Heather Rivers at the London Free Press, and this relates to some information that was on the dashboard update today at noon. Dr. Mackie, some new variants, including the South Africa variant, was recorded for the first time, and 2 sublineages of the Indian B1617 double mutant. What does that mean for the region?
Yeah, we're still, I think, globally learning what the Indian double mutant lineage means, and South African variant seems to be similar to UK variant. There's a bit of increased spread. There's a slight reduction in the effectiveness of the vaccine, but the vaccine is still very effective against South African. We don't have good data in terms of vaccine effectiveness against the Indian mutant, primarily because it is relatively new and we've seen so few cases. So that data will continue to grow over time. We don't have a good answer right now what it means.
Thank you, Dr. Mackie. And I know there are some members of the media who have similar questions in the queue. So in order to get through as many questions as we can, if we see some repetition, I'm just going to skip over those if they're similar enough. A follow-up from McKinley Leonard Scott. Dr. Mackie, I know that you support the opening of schools in June. Has the MLHU heard anything further on the reopening of schools in June?
Well, we certainly haven't heard a decision. There was a letter that was broadly distributed from the provincial government to all medical officers of health, but also all of the school boards, children's hospitals, all sorts of partners that asked for input, described some of the information and then asked a number of questions about school reopening, whether it should be delayed till September. Is it safe to go back with just one vaccine dose and the teachers, all those sorts of things. And the request was for an answer by Friday. So we will certainly submit that, and I imagine others will as well. And there also was a conversation at noon today with all medical officers and the chief medical officer of health that again, reiterated the strong consensus among medical officers that reopening schools would be a net positive for health. There would be huge mental health benefits for children and families. And, I also understand that this must be a difficult decision for the government to make because, situations like Manitoba where they have a high vaccination rate and reopening has actually led to another wave. So I'm sure that's weighing on their decision-making process. Regardless, the key thing is that, the public education and in general, primary and secondary education are incredibly important for the academic health, as well as the well-being of students, not to mention families.
Let's go to our next question. And Dr. Mackie, there are a couple of these as well related to the death that was reported today on the online dashboard. From Heather Rivers at the London Free Press. Dr. Mackie, were there underlying conditions or other circumstances of this young man in his 20s who died? Was he vaccinated? And are there any more details?
Thanks for asking about vaccination status, Heather. This 24-year-old man was not vaccinated. Again, a poignant reminder that we absolutely need everyone, and they need to get vaccinated. Young people need to get vaccinated to protect themselves, their family, and everyone in their community. So in the question of underlying conditions, we don't have more information on that at this point. What we do know is that there is a coroner's investigation. There is no doubt that COVID is a contributing cause of death. There may be others, and that the coroner will determine.
The next question, Dr. Mackie, is from Sophia Rodriguez at CBC London. Dr. Mackie, what will be your answer to the Premier on his questions regarding schools reopening? Would it make sense for our region to reopen schools for the last month of the academic year without raising the number of cases too high? And Mayor Holder, Sophia would also like to know what you think about reopening schools this academic year.
Yeah, so Sophia, I don't think there would be an appreciable impact on our case counts here. Absolutely would make sense. Even 2 weeks would make a difference for students and families. And I'll be happy, Sophia, to circulate my response to the letter when available.
Mayor Holder.
Well, thanks, Dan. And Sophia, thanks for that. You know, it's a tough balancing act. I don't think anyone wants to be in the Premier's shoes as what are we trying to do? We're trying to balance issues of health and the potential for COVID. And clearly some regions are still hotspots, and that has to weigh on his mind. And I'm referencing him because that's what you asked. Let me tell you what I'm hearing. I'm hearing from Londoners that the number one thing is give us certainty. If we're going to reopen, so be it, but let's know that. If we are going to close until September, so be it, but let's know that. But here's what's critical, and that is that what's paramount, be it June, be it September, is that the health of our students has to be top of mind. And when I say health, as Dr. Mackie knows well, we're talking physical and mental health. It goes both ways. And it's a reminder that if we want to ensure our schools as the safe environment that they should be, and to give our students as well as their teachers confidence, is get your shot. You've heard it several times already from the medical officer of health and myself, but now the 12 and up can get the shot. We've got capacity, book it. And if Dan was doing the booking, I'd say book him, Dano, but I can't say that. But what I would say is, folks, just make sure that your families get the shot. Now there's no excuse. Over to you, Dano.
Thank you, Mayor Holder. I have a couple of children who are eligible to get the vaccine. One has received their first dose and the other one will in the next couple of days. So yes, by all means, if you haven't booked an appointment, please do so as soon as you can. Let's go to the next question. Dr. Mackie, Merrick Sutherland from CTV London is chiming in. Dr. Mackie, with Western announcing a requirement of at least one shot of the vaccine for students living in residence, is this something we're going to see on a larger scale with events, institutions, or public gatherings? And two, as the vaccine is not mandatory, is this walking a fine line in terms of people's civil liberties for those who do not want to get the vaccine?
Thanks for the question, Merrick. There is a long and well-tested history of requiring vaccinations for schools in Ontario. The Immunization of School Pupils Act currently requires vaccination for a wide range of serious vaccine-preventable diseases, like polio, for example. And the the legal precedent is there. That has definitely been tested many times. The response if an individual is not vaccinated, so that there is a conscientious objector process. It is fairly involved, so people have to do, online education. They have to sign forms, get, notarized letters signed, but it is possible to go through a conscientious objector process. And then the consequences are not, serious issues like large fines or other. The consequence is simply the child is excluded for school for a maximum of 2 weeks until the vaccine is obtained. But it is something that happens every year. One of the programs that we have at the Middlesex-London Health Unit is to go through the immunizations of schools children each year, to be in contact with the parents, make sure that we have options for people to get vaccinated and facilitate that process. So there is not a civil liberties issue. The other side of that rights issue is that, students deserve a safe place to learn. And if they're having to go to classes with people that are not vaccinated and potentially putting them at risk of developing COVID, then that's a serious infringement on their rights as well. And hopefully that answers most of your question. Eric, feel free to ask again if I missed a part. And I see that the mayor wants to comment as well.
Yeah, I appreciate, Merrick, the question about schools. There's a greater good here that has to be considered, and this is a community good. So while we're talking about schools, I'd go beyond that. And frankly, we have an obligation as citizens of this community to take care of our families and each other. And the most prudent, effective medical way to do that is to get your shot. I know we've had the odd protests here in London by some folks who come back repeatedly or from away, and I'm glad they have the right to be able to do that. But I absolutely and categorically disagree with their decision to not take the shot. And the good news is they're not preventing those who choose to and want to be able to do that. But were it up to me, that would be less optional. That is not up to me, and I know we don't live in that kind of a society. But that's why we cajole, we convince, we give statistics. We talk about the 275 families who are suffering because here in London, Middlesex, because their loved one died, and that's pretty serious. So, Dr. Mackie, I'm not sure how many times we can deliver that message, but we'll do it as often as we have to.
Thank you, Mayor Holder. Thank you, Dr. Mackie. We have a couple of questions from Hope Mahood at the Western Gazette. And Dr. Mackie, this speaks to some of the process that went into the decision to require vaccination of students living in Western residences coming for the next semester. Dr. Mackie, how did the outbreaks in Western residences this past spring influence your decision to urge President Alan Shepard to mandate vaccinations in Western residences? And a follow-up question, what would you say to students moving into residence this fall? And I think what Hope is asking is who are feeling nervous about getting vaccinated.
Yeah, thanks for the questions, Hope. So I'll start with the outbreaks at Western residences. Definitely a factor in our thinking on this. Not just at Western, you've seen outbreaks in residences in many places across Canada and beyond in those post-secondary res sort of situations. There are inherent challenges with containing a coronavirus or any sort of outbreak where people are sharing washrooms, sharing kitchen space, and otherwise living in close quarters, and where they're doing so as part of a cultural decision that they're making to live closely with other people. That's part of what living in res means. And so we've got to see those students vaccinated this year if we want to keep them safe. On the second part of the question, I appreciate the question. So the question around what do we say to people who might be feeling nervous about getting vaccinated? There really are lots and lots of conspiracy theories, inaccurate and unscientific anti-vaccine theories, accusations, etc., circulating online. And so I could understand why young people might have some of those concepts in their minds. I would say, part of it is sticking to your credible sources. It's just too easy to spread inaccurate information through social media. Formal media has an ethical bar they have to meet. They've got an editing process to make sure that, grossly inaccurate information doesn't enter into their publications and broadcasts. So in general, seek input, seek your news sources through formal media. If you're looking for scientific and technical information, healthunit.com is a great source, but also Health Canada, even US CDC websites, well-designed, evidence-based, reviewed by experts. And so you're not getting somebody shooting from the hip or, the latest random anti-vax conspiracy theory.
Thank you very much, Dr. Mackie. Let's go to our next question, and it comes from Sawyer Bogdan at 980 CFPL Global News Radio. Dr. Mackie, should people who've had the first dose of the vaccine continue to act as though they are unvaccinated? Can they get together with other people who have been vaccinated?
At this point, people that have had one dose should continue to act as if they're unvaccinated. In fact, we don't have a lot of changes to the rules at all for people that are fully vaccinated at this point. That will likely begin to change over the summer as the vaccination rates get higher. The issue is we have, good but not excellent vaccination rates so far. They will be very good or excellent soon. So we're getting there. But right now, they're not where they need to be. Second, we have significant disease spread. We still have a lot of cases of COVID in our community. And so the vaccine isn't perfect. And if you end up taking actions or changing your behavior in a way that puts you at higher risk and a lot more contacts, then you're going to potentially reverse the benefit that the vaccine has created for at least from the first dose. So yes, people who are vaccinated with just one dose, and really everyone, should be respecting public health measures, masking, distancing, keeping your interactions outside, small groups, etc.
Thank you, Dr. Mackie. And just looking at the clock, bearing in mind that we are in the playoff season, I'd just like to look to Dr. Mackie and Mayor Holder to see if we're good to go into overtime. Are we good to go into overtime, gentlemen? We'll keep it short.
You're not talking about supporting the Toronto Maple Leafs finally, are you, Dan?
Our next question is from Sawyer Bogdan at Global News Radio, 980 CFPL. I just want to, we got work to do here. Here we go. Dr. Mackie, should Fanshawe College require students and residents to have received at least one dose of COVID-19 vaccine? Would you want Fanshawe and Western to expand this requirement further, perhaps making them mandatory to attend on-campus activities or in person?
So, we certainly provided the same recommendation to Fanshawe that we did to Western around having students vaccinated in their residences. I know they're considering that recommendation seriously. We haven't heard if they have made a determination yet. And I mean, the more we can encourage and support vaccination, even if it's through policies of making it mandatory, there's going to be a huge net health benefit. So from a health perspective, there certainly is every reason to expand the mandatory aspect of vaccination. There are other considerations, which I understand, but there certainly wouldn't be a health problem with doing that.
Let's go to our next question. Chantal Lee is joining us from the Globe and Mail this afternoon. Hello, Dr. Mackie, says Chantal. Dr. Mackie, do you think schools should reopen before the end of the school year? Premier Ford released an open letter addressed to medical experts today asking for their input. How do you plan to respond to his letter?
Thanks for the note, Chantal, and for joining us. It's a pleasure to have the Globe represented. Absolutely, the schools reopening would have a massive health benefit. We really have a crisis of mental health right now in schools for children and family. So, I understand that the Premier has a lot of things to consider on this. It must be a very difficult decision, but certainly as a medical officer of health, from a health perspective, strongly support schools reopening as soon as possible.
And a follow-up question from Chantel, Dr. Mackie. Dr. Mackie, can you tell us a little bit more about the meeting you had with the other medical officers? Are you all in consensus that schools should reopen before the end of the school year, or is there any disagreement?
I'm afraid, Chantel, I can't really go into detail. Those sorts of conversations are, meant to be sort of a Chatham House rules where there aren't, quotes given or attribution made. If you need to hear from medical officers across the province, you should probably ask medical officers across the province.
Thank you, Dr. Mackie. I'm not sure if I'm still, we have an authentication process here at the Middlesex-London Health Unit for security purposes, and right in the middle of your answer, I was having to engage in that. So it looks like I got it cleared up fast enough. Let's go to our last question in the queue for today. Jane Sims, just in under the wire. Dr. Mackie, I'm sensing there's a blitz on getting younger people in their doses. Are you concerned about vaccine hesitancy in younger adults? Are they booking appointments in high numbers, or is there concern about the uptake?
Yeah, we're getting pretty strong bookings. Again, the news hadn't even really gone out when we opened up on Sunday, and we saw 8,000 or 10,000 appointments scooped up right away that morning. And we've seen thousands of bookings made every day since then. We're putting about 3,000 appointments in the system each day as we book out the next day of that sort of 4-week period. And we're seeing more than 3,000 scooped up each day. So I'm not concerned about the vaccine hesitancy or uptake at this point. I am concerned about getting the message out. So, we keep talking about it, working with school boards and private schools to get a message out to families as well, to make sure that they have the right information and that they have as much information as they need to make an informed decision and get their appointments booked.
Thank you very much, Dr. Mackie. And if I could just build on that, there will be some social media posts indicating that there will be some virtual town halls early next week for parents and guardians in not only Middlesex-London, but also in the Southwestern Public Health Unit region. That brings us to the end of our questions for this afternoon. Thank you so much for joining us. We will be back with our next virtual media briefing on Monday, which is the 31st of May. So we look forward to seeing you then. Between now and next Monday, have a great rest of your day, have a great rest of your week and weekend, and so long for now.